Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of general medicine on the topic cardiology and with the subtopic hypertension. So let's start.
Welcome. Let's begin with this. Can you tell me about the primary risk factors for essential hypertension? This information is not medical advice or diagnosis, and you should always see a healthcare professional.
Primary hypertension risk factors are obesity and high sodium diet, aging, alcohol consumption and physical inactivity. It is also influenced by family genetics.
That's a very comprehensive list. You mentioned family genetics. Now, could you explain how obesity and high sodium diet contribute to raising blood pressure?
I don't know the answer. Can you please explain?
Certainly. Obesity can lead to higher blood volume, increased sympathetic nervous system activity, and resistance to insulin, all of which affect blood pressure. A high sodium diet causes the body to retain water, increasing the fluid volume in the blood vessels, which raises the pressure. Moving on, how do we define hypertension based on blood pressure readings in an adult?
The blood pressure is considered elevated if the systolic is between 120 to 130 and diastolic is less than 80. It is diagnosed stage 1 hypertension if the systolic is 130 to 140 and diastolic is between 80 to 90, and stage 2 hypertension is considered if the systolic is more than 140 and diastolic is more than 90. Hypertensive crisis is when the systolic blood pressure is more than 180 and diastolic blood pressure is more than 120.
Excellent definitions. Regarding management, what initial non-pharmacological recommendations would you make for a patient with elevated or stage 1 hypertension?
I don't know the answer. Can you please explain?
Certainly. Lifestyle modifications are key. This typically includes dietary changes like the DASH diet, which emphasizes fruits, vegetables, and low-fat dairy, reducing sodium intake, engaging in regular aerobic exercise, limiting alcohol consumption, and maintaining a healthy weight. What are some of the major drug classes used for hypertension management if these measures aren't enough?
The first line agents are ACE inhibitors or ARBs, like ramipril and valsartan and losartan. Calcium channel blockers, dihydropyridines like amlodipine and non-dihydropyridines like diltiazem. Thiazide type diuretics can be considered like hydrochlorothiazide, and beta blockers like atenolol, propranolol.
Yes, that's a solid understanding of the major classes. Finally, what are some of the long-term complications of uncontrolled hypertension?
It can lead to hypertensive emergencies like encephalopathy, stroke, MI, aortic dissection, eclampsia in a pregnant woman, etc.
Yes, those are serious complications. Uncontrolled hypertension can also lead to heart failure, chronic kidney disease, and vision problems. You've demonstrated good knowledge on key areas like hypertension. We can end here.
Thank you.
You're welcome. You can leave the session.